This is part 2 of my 12 walkaway rules, warning signs that a patient may be dissatisfied with the results of surgery. Follow these rules and you're much more likely to be satisfied with your hair transplant results. So here in part 2, I'll discuss walkaway rules 7 through 12. Number 7, if the surgeon does not offer both strip, FUT, and FUE surgery, walk away. There is no area of specialization where there's only one way to do something. I don't care if you're a physician or an attorney or a carpenter or an electrician or an artist or an athlete. You have to have multiple ways of dealing with a problem because not everything presents the same way. If you only have one tool, only one technique, it'll work a lot of the time, maybe most of the time, but it won't work all the time. There are situations where strip is absolutely more appropriate than FUE. There are situations when FUE is absolutely more appropriate than surgery. But if you could only do one or the other, and you don't send your patients to other doctors when they need that, then some of those patients are going to get the wrong procedure. In my office, we do both, so we can make the best recommendation for each of our patients. And it also tells me that a doctor hasn't been serious about learning the various tools. We have to have multiple tools in our toolbox and be expert at using those tools. So if your surgeon does not offer both strip surgery and FUE surgery, walk away. Rule number 8. If the doctor guarantees a full, thick head of hair, walk away. Now, we all love when our patients come back and they have a full, thick head of hair, but not everybody can get that. You have to have the right kind of hair, the right kind of hair color and skin color, and everything's got to work perfectly. Other patients just can't have that. So we tell our patients what their appropriate expectations are. But if you guarantee every patient a full, thick head of hair, we know we're not going to deliver that. We know those doctors are not being truthful. And you don't want to work with a non-truthful doctor, so just walk away. Rule number 9. If you're told, do it now before it's too late, walk away. This is sort of like that high-pressure sales thing I talked about in part 1. But this is about if you don't operate now, you might lose those grafts and we can't use them in the future. Well, by definition, we shouldn't be transplanting any hair follicle that you might lose in the future. Otherwise, we shouldn't have touched it. So by definition, the hair follicles you will have in 20 years are the same hair follicles you have today. It's never too late. You might lose more hair, yes, but you won't lose the transplantable hairs. So that's just it's again a high pressure sales approach to try to convince you to make a mistake. Don't do it now. Do it when you're ready. Then it's appropriate. But if they're pushing you, just walk away. Rule number 10. If your surgeon uses traveling technicians, walk away. What does that mean? Well, if a doctor does only 1 or 2 procedures a month, this kind of surgery requires a lot of staff, well-trained staff. And if you have all these well-trained people standing around the office doing nothing for weeks at a time, it's economically not feasible. So doctors that are not busy will hire traveling teams of doctors to come in and basically do the procedure for them. Now, the technician is running the office and the doctor. It's not the doctor running the practice. It's dangerous, and you're losing control. So in an office where we do surgery a great deal, we have 100% of our staff as full-time employees. And that's the critical question to ask. And again, a question you need to ask your surgeon. Doctor, does all of your staff work for you full-time, or do you use traveling technicians? If you're using traveling technicians, that means they're not busy enough to employ a full-time team. Just walk away. Rule number 11. If the doctor insists on using large grafts, walk away. Now, this is much less a problem than it used to be when we still had doctors using big round plugs. Almost all doctors use the follicular unit, a grouping of 1, 2, 3, and sometimes 4 hairs. That's a natural grouping of hair. It's what nature uses. That's why when we move those around, hair transplants look great. But if you have a hard time, you don't have enough staff to do it properly, you'll combine those follicular units into larger groupings. It saves money, it saves time, it requires fewer staff, but it doesn't look natural. So if your doctor talks about using these multi-graft units, that's a warning sign. Just walk away. Finally, rule number 12. If your doctor charges by the hair, walk away. That's unethical. How do we charge? We charge by the work involved in what we do. It's a lot of work, It's a lot of time, it's a lot of people. But the work of harvesting and planting a single hair graft and the work of harvesting and planting a 3-hair graft is exactly the same. But doctors that charge by the hair will charge 3 times as much for that 3-hair graft as they do for the single hair graft. So they might tell you the number 2,000, but you're not getting 2,000 grafts, you're getting 2,000 hairs, which might be 800 or 900 grafts, but you're paying much more than you should. We see that all the time here. It's frustrating. The patient is overpaid and they've been under-delivered. So if your doctor charges by the hair and asks that question, walk away. It's a sign of a doctor who's unethical. Now, most of these rules are just common sense, and yet many patients are hesitant to ask their surgeon tough questions. Any good surgeon will be happy to discuss all of these talking points and put your mind at ease. I hope you can use these walkaway rules to your advantage. Thank you for watching, and I'll see you next time on the Hair Transplant Road Show.